get started here. Good morning, everyone. Thank you for joining us this morning. Just a couple reminders as far as Zoom goes. If you click on the view at the top right corner of your screen and place your view in the speaker view, you'll be able to see Dr. Kantzes and her presentation a little more clearly on your screen. And throughout today's presentation, if you have any questions, feel free to click on either the chat box or the Q&A box, and we will be glad to answer those at the end of her presentation this morning. We're happy to have with us again Dr. Karen Kantzes from Cleveland Hearing and Speech. We were just trying to figure out when the last time she was with us, and it seems like it's eons ago. It's been several months anyhow, so we're happy to have her back with us today. And she will be speaking about the importance of hearing on maintaining your independence. We often think of cognition itself as being maybe a barrier to maintaining independence and don't really think about how hearing impacts maintaining independence. So we're happy to have you with us today. And before you get started, if you wouldn't mind sharing a little bit about yourself and about Cleveland Hearing and Speech, we'd love that.
Absolutely. Thank you so much for having me today. For those of you who are not familiar with the center, Cleveland Hearing and Speech Center is a nonprofit organization that serves people for speech therapy, helping them hear better. We also have a department that's community services for the deaf and hard of hearing. So we do case management for individuals who are deaf or hard of hearing. We also do sign language interpreting. We are celebrating our 100th anniversary this year. So that's very exciting for us. And we were actually founded by the daughter-in-law of President Garfield, Helen Newell Garfield. So, we've been around for ages and are continue to hope to be here for another 100 years. So thanks again for having me today. So let me just start sharing my presentation here. Let's do that. All right, so today we are going to talk about the importance of hearing and maintaining your hearing on maintaining your independence. So the main points today, we're going to talk about what are instrumental activities of daily living, how hearing loss impacts those instrumental activities of daily living, how hearing loss interacts with other diseases or medical conditions, what you should do if you suspect a hearing loss, and what are some treatment options for hearing loss. So first, just a little bit on some statistics about hearing loss. There are about 48 million people in this country who do have a hearing loss. It does primarily affect people as they get older, and about 2/3 of the population age 70 years or older have a hearing loss. I know, I will say personally, we are seeing a lot of people coming into our office in the past year or so, mainly because of the use of face masks. This is really affecting people's ability to hear. The face mask does make it much more difficult for people to understand what others are saying. But also, I think a lot of people perhaps had some difficulty hearing previously, but they could get by. They could use visual cues and they could kind of figure things out. And so they were persevering and they were getting by. But with the use of face masks now, not only does it make it more difficult to be understood, but it's taking away those visual cues. So we're seeing a lot more people come into our office because they're noticing the effects of those hearing loss more. Unfortunately, about 25% of people who have a hearing loss seek treatment for that hearing loss. So the majority of people who have hearing loss do not do anything about it. They just kind of live with that condition. And unfortunately, there are some negative side effects of not treating your hearing loss. Several years ago, the National Council on Aging surveyed thousands of people in this country who had hearing loss. And about half the group had treated hearing loss, meaning that they were wearing hearing aids, and the other half had untreated hearing loss. And what they found was that those individuals with untreated hearing loss reported more episodes of sadness and depression. They reported more worry and anxiety. They reported more episodes of paranoia. They were less involved socially, so they were not getting out and doing those social activities that people with treated hearing loss were doing. And they were also reporting more episodes of emotional turmoil and insecurity. So you can see there's some really negative side effects of not treating that hearing loss. So you may think, well, I'm not having difficulty hearing, but that's not a big deal. I don't have to do anything about it. But there really are some negative side effects to not doing something about the hearing loss. Conversely, on the flip side, people with treated hearing loss, so those people who were wearing hearing aids, reported better relationships with their families. And if you could think about that, then they were better able to communicate with their families, so that led to a better relationship. They had better feelings about themselves. They had improved mental health, and they had greater independence and security. And that kind of gets around to our topic today with maintaining your independence if you have issues with your hearing. So let's get back to that idea of the instrumental activities of daily living. So this is a little bit different than activities of daily living. Activities of daily living are typically things that we do to take care and maintain ourselves. So it might be being able to feed ourselves, being able to maintain our body. So dressing ourselves, bathing ourselves, brushing our teeth, combing our hair, things like that. Instrumental activities of daily living are kind of a higher order function of being able to maintain ourselves and to take care of ourselves. And they include being able to go shopping or run errands. So it's a matter of, can you make a grocery list? Can you plan out your meals for the next week or so? Can you make a grocery list from those items? Can you then go to the grocery store and buy those items and then prepare that food? So that's one element of an instrumental activity of daily living. Another is, can you manage your prescriptions? So do you go to the doctor, find out what your prescriptions are, then know how to get those prescriptions filled and refilled, and know when you're supposed to take the medications, how often is it? Are you supposed to take it before you eat, after you eat? Are you supposed to drink something with the medication? Are there certain medications that you take at certain times a day? So can you manage everything with those prescriptions? Also, being able to communicate effectively. So primarily on the phone or even by email or by the snail mail. So can you make a phone call to schedule an appointment to see your doctor? Can you make an appointment to schedule, an appointment with your dentist? Can you email a provider with a question? Can you, this sounds ridiculous, but can you actually fill out an envelope to know how to send out a letter? And it seems very basic, but I have teenagers and they have a hard time with it. They're like, where does the stamp go? Like, that's the upper right. So, just knowing how to fill out an envelope and know how to address a letter. Another instrumental activity of daily living is being able to maintain your home. So it's doing laundry, it's doing dishes, it's cleaning your home, it's doing basic repairs on your home. So, a light bulb burns out, can you change that light bulb? So just some basic things to be able to maintain your home and your living space. Also, it includes transportation. So either can you drive yourself to an appointment, or can you drive yourself to the grocery store, or do you know how to figure out and be able to use public transportation so that you can get those activities completed. And finally, it's managing your finances. That's another, the final instrumental activity of daily living is managing your finances. So that is building a budget, sticking to that budget, paying bills, balancing a checkbook, those types of activities. So as I said, this is a little bit different. The instrumental activities of daily living, a little bit different, a little bit more higher order functioning than your just activities of daily living. Typically, the activities of daily living, like our self-care items, are typically learned when we're young children. So if you think about, a 2-year-old learning how to put a shirt on or learning how to feed themselves, these instrumental activities of daily living are typically learned when we're teenagers. So, it's learning how to drive, it's learning how to go to the grocery store and, buy those items. So those are typically activities that we're learning in our teenage years, our early 20s even. But the goal is, these are the activities that you have to have in order to be independent, so that you're living independently on your own and you can function as an adult, basically. So how does hearing loss impact those instrumental activities of daily living? Well, let's think about this. So if you have to run an errand, you have to go to the grocery store, you have to go to the bank, are you able to effectively communicate with that person? A person with a hearing loss may have a difficult time understanding what the teller is, that bank teller is saying, or what the store employee is saying. And especially right now, it's really difficult because a lot of public places have plexiglass shields up. So they're wearing masks and they have a plexiglass shield that's separating you from that person. So that is really, really difficult right now to communicate in those situations. I know personally, there's a lot of times I have a difficult time hearing those employees, and I'm just kind of going off of rote memory. Like I'm at the grocery store and I know they're probably going to ask me for my phone number because they're going to look up my frequent shopper club card, or they're going to ask me if I want paper or plastic. Like, I know that there's pretty much a script they're going to follow. And sometimes they ask me a question. I'm like, that doesn't fit into my scheme of things that I'm trying to figure out what they said. So, so it's really difficult to communicate and do those errands if you have a hearing loss or if you're having difficulty to communicate. A person with a hearing loss may also have difficulty understanding instructions for taking medications when they're talking with a physician or a pharmacist. So if the person has a hearing loss, they have an appointment with their doctor's prescribing a new medication, and if the physician's talking very quickly, or if they're looking down at their computer and typing during that conversation, they may not understand that I need to take this medicine before breakfast or after breakfast or before dinner or with food or not without food. So it's very, and then they might take the medication inappropriately. So hearing loss can definitely impact how they're handling those prescription medications. A person with a hearing loss may also have difficulty hearing over the phone when they're trying to schedule appointments or conduct personal business. So I think we are relying on the phone more. Many businesses, they're opening up now, but I know banks have been closed. Like you can use the ATM or you can use the drive-through, but the inside of the banks have not been open. Perhaps people are relying on the phone more to make phone calls as opposed to going in person and talking to people. But a phone conversation can be really difficult for people with hearing loss. The problem with the phone is that it takes away visual cues, although you don't have a lot of visual cues with masks on anyways, but it takes away those visual cues. Sometimes the phone connection isn't always that great, so it's not a great sound quality, and that makes it much more difficult to have that conversation over the phone and to really understand what is being said. It can also impact, at home, are they alerted to sounds in their environment? So can they hear if their fire or smoke alarm goes off? Can they hear if the different equipment, the different machines that we have to make our lives easier, can they hear when those things beep or buzz, or to let you know when they're done or if there's a problem? I know, like the wash machine, you might put a load of wash in, but then at some point in time, if there's an uneven load, you're going to get some type of signal. Well, a person with a hearing loss may not be able to hear that sound and then not realize that there's a problem. Or are there different sounds that they're being alerted to in our house? One example I always give is years ago we needed to replace our furnace, and we knew that we had to replace our furnace because it didn't sound right, and it was running. It would like run for 5 minutes at a time, turn off, run for 5 minutes at a time, turn off, and we knew that there was a problem because we could hear that it wasn't working properly. But a person with a hearing loss may not hear like how those things sound, and you'd be alerted to that there's something wrong with that equipment. They may also not be able to hear someone when they knock on their door, ring their doorbell. So they may not even be alerted to the fact that someone is at their home. And a lot of times we hear this with patients, it's their daughter or their son who's trying to come over and check on them and see how they're doing. And they're knocking on the door and ringing the doorbell. And unfortunately, the person can't hear them, isn't answering. And that gives the person who's trying to check on them some anxiety also. They may also have difficulty hearing safety vehicles while driving. And people with hearing loss or people who are deaf aren't prohibited from driving. Obviously they can drive, but you just have to be more alert visually to your surroundings, because you may not hear a siren coming, or you might hear a siren but not be able to locate where that sound is coming from. So you need to really be alert visually if you have a hearing loss when you're driving, to make sure that you see any emergency vehicles approaching so that you can pull over, obviously. But it could even be, can you hear things with your car to make sure that your car is running properly? And another story I have, many years ago, I fit my grandmother with hearing aids, and the first time I saw her after she started wearing her hearing aids, she complained that she needed a new car now. I'm like, well, I don't understand why you need a new car now. She's like, well, my car sounds terrible. And she had no idea that her car didn't really sound that great, that it wasn't really running all that well because she couldn't hear it. But now that she was wearing hearing aids, she could tell that there were some things probably wrong with her car and that she needed to take it in to have it looked at. So, it's important to be aware of your surroundings and to be able to hear those environmental sounds so that you know if something is off and can get it looked at. If a person is using public transportation, a person with a hearing loss may have difficulty hearing those transportation workers. So, can they hear the bus driver? Can they hear their Uber driver? Can they hear a taxi driver? Can they hear the announcement that comes over? So, do they hear the announcement for the bus station or the train station that the train is approaching or that it's their stop? They might have a difficult time understanding those public announcements. A person with a hearing loss may also have difficulty managing their finances if their cognitive skills decline, or even managing their medications if their cognitive skills decline. Now, how does that relate to hearing loss? So what we're finding is that they are doing research of hearing and cognition, and they are finding out that there is perhaps a relationship between hearing loss and cognitive abilities. Now, we're not saying that hearing loss causes issues with cognition or that cognition causes issues with hearing loss, but we know that there is a relationship. And we know that untreated hearing loss increases the risk of dementia by 50%. So we know that there's this relationship. We don't know what the cause is. There are several theories as to why hearing loss and dementia could be related. One is related to social isolation. So very frequently when a person has a hearing loss, when they're in social settings, they find them not to be as enjoyable as they once did because they can't follow the conversation. So they don't understand what's being said. So perhaps they either ask for repetition frequently, which makes some people uncomfortable to constantly be asking people to repeat themselves. They may also then start to feel embarrassed because perhaps they answer a question inappropriately, or they laugh when it wasn't really a statement that was meant to be laughed at. So they may start to feel embarrassed. They might feel left out of those situations, that they can't really participate in those social settings. And so they start to withdraw socially, and they don't really interact anymore with other people. And that decline in social interaction can lead to depression. We know that depression is related to a decrease in social interaction, and that there's a relationship with depression and hearing loss also. So it could just kind of be a vicious circle, unfortunately, that the person starts to withdraw, and that may lead to some issues with cognitive ability. Another theory about why hearing loss and dementia are related relates to the concept of cognitive load, which I like to think of as brain power. So when a person has a hearing loss, when they're trying to communicate with someone, they're not hearing the entire message. The hearing loss basically acts as a filter, and it filters out certain sounds. So that person is constantly trying to fill in those blanks and fill in and figure out what the person is saying. So they're using a lot of brain power and concentration on that conversation. And so scientists think that perhaps if you have a limited amount of cognitive load, a limited amount of brain power, and you're pulling more resources in order to understand a conversation, that it might pull those resources away from other cognitive activities. It could also, another theory is that the hearing loss could actually cause a change in the brain function. So if a person has a hearing loss, the ears do the hearing, but it's actually, the ears pick up the sound, but it's actually the brain that does the hearing. So it's a brain event when you are listening and understanding what a person is saying and trying to decipher what they're saying. And it could be that because of the hearing loss, those pathways from the ear to the auditory part of the brain actually changes how the brain functions. So it could just be that there's a change in the actual structure of the brain, and that's why that might be related to the dementia. And then finally, it could be that there's a completely different cause that is then affecting both things, and we don't know what that cause is yet. So we don't know a lot about this, but we do know that there's that relationship, that untreated hearing loss has a higher risk of, a person with untreated hearing loss has a higher risk of having dementia. It's not just cognitive ability and dementia that we have found has a relationship with hearing loss. That's one part. We do know that there is actually a relationship with a lot of other health conditions with hearing loss. We know that hearing loss is related to cardiovascular disease, and actually people with a low frequency hearing loss, so for those low pitch sounds, are considered at risk for cardiovascular events. And that's just because we know that there's blood flow that goes to the ear. And so if the blood flow to the ear is decreased, that may cause a hearing loss, but why is the blood flow to the ear decreased? There might be a more systemic global problem in the body, that there's some cardiovascular issues. Hearing loss and tinnitus is also related. Tinnitus is a ringing or buzzing sound that the person hears in their ears. It's not from an external sound source. It's something internal in their ears. And there, a lot of people with hearing loss do have that ringing, that tinnitus sound also. So we know there's a relationship with that. There's a relationship between hearing loss and hypertension, high blood pressure. And hypertension could be an accelerating factor in hearing loss. There's a relationship with smoking. Current smokers have a 70% higher risk of hearing loss than non-smokers. And that could have to do with that blood oxygen supply to the ear, that it decreases that oxygen supply and can then cause some havoc with the ear and cause some hearing loss. As I mentioned before, we know there's a relationship with hearing loss and isolation, that untreated hearing loss can cause someone to start to withdraw socially and isolate themselves, and that can lead to anxiety, depression, and cognitive decline. We know that there is a relationship with hearing loss and diabetes. Hearing loss is twice as common in people with diabetes as compared to their peers without diabetes. Also relationship with hearing loss and obesity. The higher BMI or body mass index and larger waist circumference are associated with an increased risk of hearing loss in women particularly. So that's something that they have studied. That's different between men and women, but it is affecting women more. Ototoxicity. So there are medications that can cause hearing loss or ringing or that buzzing noise, that tinnitus sound in the ears. So if you've been put on a new medication and you're noticing some changes in your hearing, if you're starting to hear a ringing or buzzing sound, I would check the side effects of that medication to see if hearing loss or tinnitus is a common side effect. And if it is, I would talk to your doctor about that to see if maybe you need to have your hearing tested to see if there's been a change, or see if there's something with the dosage or a different medication that perhaps you could take that might address that issue. And then finally, we know there's a relationship with hearing loss and balance. The organ for hearing and the organ for balance are located right next to each other in the ear. And so sometimes if a disease process is affecting the organ for hearing, because of its location and proximity, it can also affect balance. But people with hearing loss do have about 3 times higher likelihood of falling. And that is primarily because they're not as aware of their surroundings. So if you have someone with a hearing loss and someone comes up behind them, and that person doesn't hear them approaching, and then all of a sudden that person talks or they say something, the person with the hearing loss may startle, and then they may lose their balance and fall. So that's another reason untreated hearing loss. You're not as aware of your surroundings, and so those sounds like that could surprise you and then could cause you to be off balance. So we know that, as I said, hearing loss is related to a lot of different other medical conditions. So if you have any of these conditions, it is a good idea to have your hearing evaluated, just to kind of get even if you're not having any difficulties, just to kind of get a baseline. And that way you have something to compare it to if you do start to notice changes in the future. So what should you do if you suspect you have a hearing loss, or if a loved one has a hearing loss, you're concerned that maybe somebody else is having some difficulty hearing? So as I just mentioned, the first step is to have your hearing evaluated. This is typically done in a sound treated room, and you'll wear headphones on your ears or little foam plugs in your ears. Typically the audiologist will ask you a bunch of questions about your history. If you've ever been around loud noises, if you have any family history of hearing loss, we usually ask if what medications you're taking, to see if there is something that might be ototoxic or might hurt your sense of hearing. We ask what difficulties you're having. We want to know what situations you're having difficulty hearing in, how frequently you're in those situations, just kind of to get an idea of your lifestyle and the different listening environments that you're spending your time in. Obviously, over the past year, our listening environments have been pretty quiet, but as things are starting to open up, at least I'm hearing from my patients that they are getting out there more, getting more involved, and they're maybe seeing family more, and so they're having family gatherings where they're around some more people and in groups of people. We typically, during a hearing evaluation, will take a look in your ears. We want to make sure that there's no wax in the ear. And then we're going to do some testing where we have you listen for different beeping sounds. Some of those beeping sounds are low pitched, some are high pitched, and we're looking to find the softest volume of sound that you can hear. And that part of the test tells us if you have a hearing loss or not. And if you do have a hearing loss, how much hearing loss is there? Is it a mild hearing loss, moderate, severe, profound? It'll also tell us the type of hearing loss. So is it a type of hearing loss that perhaps you should go see an ear, nose, throat physician because a medicine may correct it or surgery may correct it? Or it'll tell us if the hearing loss is more of a permanent nature, in which case it may not be medically treatable, but that doesn't necessarily mean there's not other non-medical, meaning non-surgical, non-prescription medication treatments available to help you. We also do testing with speech to see how clearly you can understand speech sounds. Sometimes, typically it's done in a quiet environment. It can also be done in a noisy environment just to see how well you can understand speech. And that's a really important part of the test because it kind of gives us an idea of how clearly that signal is getting in. So how clearly that signal travels from the ear to that auditory part of the brain to see how well you can understand speech. So with that hearing test, the audiologist can then discuss with you what your options are. So the audiologist is going to look at the severity of your hearing loss. We want to know, if hearing loss is present or not. And as I said, is it a mild loss, a moderate loss, a severe loss? So, and depending on the severity, the recommendations may change a little bit. We look at your lifestyle. And this is a really big part of that discussion with your audiologist. As I said, I can have two people with exactly the same hearing loss. So their hearing test is exactly the same, but they lead very different lifestyles. If I have one person who's primarily lives at home or primarily at home in quiet environments, maybe only talks to one or two other people, versus somebody else who's very active and going to meetings or going to the theater and in pre-COVID or hopefully soon times, their lifestyles are very different. So their listening needs are different. So we take that into account. So we want to know, as I said, where are you having difficulty hearing? Where do you want to be able to hear better? So we typically ask, what are your top 3 situations that you want to hear better? So you want television better, you want to hear when you have Sunday dinner with your family better, you want to hear better over the phone, whatever those situations are. And we want to know how frequently you're in those situations. So, is it that you're in this, this is a really difficult listening environment for you, but it happens once every 6 months? Or is it something that happens every single day that comes into play? And how important those situations are to you. So you might have difficulty hearing at the theater, but you go once every 5 years and you just enjoy getting out, so it's not a big deal, versus I go to the theater every month, and this is a really important part of my life, so this is a really big deal. And obviously we want to assess the person's ability for your motivation to seek help. So are you recognizing that you have some difficulty with your hearing, and do you want to make a change to help improve that hearing? I know I see a lot of people who come in and say, well, I'm here because this person is making me come here today. And then when I ask, well, how do you feel you're hearing? They're like, well, I think I'm hearing this fine. And so that person probably isn't prepared or motivated yet to do something to make a change about their hearing. And that's fine. I'm happy to talk to that person and kind of plant some seeds and kind of give them some information that they can then take and kind of mull it over a little bit. And then perhaps down the road, they're ready to do something about their hearing. So what are some treatment options for hearing loss? So I mentioned previously that sometimes when we do the hearing test, we find that there might be a reason for medical intervention. So perhaps to take prescription medications or surgery to help correct the hearing loss. Unfortunately, that's the minority of people that we see. Most people have a permanent hearing loss that cannot be treated medically. That doesn't mean that there's not treatment options for them. And treatment options, non-medical treatment options include hearing aids. They can include assisted listening devices, and they include using good listening strategies. So we'll talk a little bit about those. When you're thinking about hearing aids, there's several different things that you have to think about. And once you kind of have a decision about each one, then you kind of have an idea of what hearing aid is best for you. And this is can be a really overwhelming process for people, but like if you kind of walk through these steps, you kind of get an idea of what's best. So the first is whether you're fit binaurally or binaurally. So it's whether you're wearing one hearing aid or two hearing aids, and your audiologist can help you with this based on your hearing test. Typically, if people have hearing loss in both ears, we do recommend 2 hearing aids. And that's because it keeps you balanced. And we use both ears to be able to localize and determine where a sound is coming from. And it gives us better awareness of our surroundings if we can hear from both ears. I would recommend one hearing aid if perhaps only one ear had a hearing loss, or if perhaps one ear was so bad it couldn't be helped by a hearing aid. So you're just going to aid that better ear. Style of the hearing aid is physically what the hearing aid looks like. And determining this is based on the type of hearing loss you have. Some hearing losses are more suited with one style of hearing aid over another. But we're also going to look at your dexterity and make sure you can handle the hearing aid, make sure you can insert it independently, make sure you can clean it okay, make sure you can change the battery or get the hearing aid in the charging case. And also cosmetics kind of plays into this. So people might be concerned physically what the hearing aid looks like. So they want a certain style that they're comfortable with. The technology level is what's inside the hearing aid, how the hearing aid works. And this is really where the lifestyle comes into play. Wireless accessories. So do you need to use the hearing aid in conjunction with your cell phone? Do you want the hearing aid to be connected to your television? Do you want the hearing aid to be connected to an external microphone? Maybe you go to meetings a lot and you want to be able to give that speaker a microphone and have that sound come into your hearing aids. And then finally, thinking about the battery and the hearing aid, if you want something that's rechargeable or something that you want to be able to change the battery. As I mentioned, I kind of went through some of this already, but wearing 1 versus 2 hearing aids, it does give you better balance with the sound, and you're able to localize better. So you have a better ability to awareness of your surroundings, because you can hear sounds more around you. And you do have better speech understanding in both quiet and noisy places with 2 hearing aids, if you're using both ears. Styles of hearing aids can either fit inside the ear. They're custom made to fit inside the ear, either the bowl area of the ear or smaller into the ear canal, or the hearing aid may fit behind the ear with a wire or a tube that comes down with a molded piece that goes in the ear. And like I said, you can work with your audiologist to decide if there's a style that's most appropriate for you based on your hearing loss, based on your dexterity, based on your vision. What can you see on the hearing aid to make sure you can see it okay, and then cosmetically what's acceptable for you. The hearing aid technology, as I mentioned, really has to do with your lifestyle and the different listening environments that you're spending your time in and where you're having difficulty hearing. So this is really where you can get into differences, that there might be one hearing aid that's appropriate for one person, a completely different hearing aid that's appropriate for that person, primarily because of their lifestyle. So it's important to think about the types of listening environments that you spend your time in, how frequently you're in noisy environments, and where specifically are you having difficulty hearing. So in those different listening environments, different hearing aids may be more suited for different listening environments. So all hearing aids do really well in quiet environments. They're all going to be good at home and perhaps listening to 1 or 2 other people. It's when you get into more noisy environments that a better hearing aid or a higher level technology hearing aid may do a better job for you. So thinking about the different places that you go to during a typical day or typical week and how frequently you're in those listening environments. So, a good, like an entry level hearing aid is best for people who are primarily in quiet environments and just occasionally in noisy environments. So they're primarily at home, they're primarily talking to 1 or 2 other people, listening to television, and just rarely going out to a restaurant or in a large group of people. We considered a better hearing aid, more an advanced level hearing aid, are better for people who are kind of in a combination of quiet and noisy environments. So all of those same situations, home and small groups and television, but then occasionally, maybe more frequently going out to restaurants or are in larger group settings. And finally, those best hearing aids are for people who are really active and in a lot of different listening environments. So all those quiet environments, but also different listening environments throughout the day and a lot of noisy environments. So maybe you're adding in meetings, small groups, large groups, going to the theater, television, being outside, going to restaurants. So like I said, your lifestyle really does come into play here when you're thinking about what's best for you. Hearing aids can also be paired to different accessories. So it could be that it's paired to a cell phone, so you can hear a cell phone conversation through the hearing aids. It could be paired to an external microphone that a person wears, and that sends a sound into the hearing aids. It could be paired to cell phones, and cell phones can actually, a lot of times, be paired to the hearing aids, not only to be able to hear the phone conversation from the cell phone through the hearing aids, but also to use a cell phone as almost like as a remote control. So you can actually control the hearing aids through the cell phone. So that's another option. I mentioned rechargeable batteries. All hearing aids have a battery. They all need a battery for power, but we are now seeing here a lot of hearing aids that have a rechargeable option, which is great for people who maybe have dexterity issues, who have a hard time managing and changing that battery on their own. And so for some people, it's just a convenience. They don't mind taking their hearing aids out and plugging them in at night. They don't want to have to deal with going to the store to buy batteries or having to worry about a battery dying when they're out running errands. So it is, it's more convenient for them. I mentioned also previously with others treatment strategies, assisted listening devices. So perhaps someone really, their hearing's not that bad, but maybe they're just having difficulty hearing on the phone. So it could be an amplified phone that is necessary to help them hear better. I mentioned, with going back to those instrumental activities of daily living, perhaps someone has a difficult time hearing their doorbell ring or hearing their smoke detector. There are flashing doorbells and flashing smoke detectors that they can have in their home to make sure they're alerted. Because especially at night with the smoke detector, even if they're treated with their hearing loss, they would take their hearing aids out at night and then wouldn't be able to see or wouldn't be able to hear that smoke detector. So they might be able to see that flashing light instead. So there are kind of niche products that work with just a specific listening environment to be able to help them hear for that situation. Also with communication strategies, even with if a person's treated and wearing hearing aids, we know that hearing aids unfortunately are not going to restore a person's hearing to normal, and there might still be difficulties with hearing, especially in more complex listening environments. So it's really important to use good listening strategies. So it's important to, when you're talking to someone, be in the same room as the person you're talking to. Try to be face-to-face with the person that you're talking to. Get their attention first. So if someone's involved with watching a television show or reading a book, that you call their name, get their attention so they can break their focus from what they're doing and turn their focus and turn their attention to what you're saying to them. It's important if you're talking to someone with a hearing loss that you talk slowly and distinctly. We do, and I know I'm guilty of this, we do have a tendency to talk pretty quickly, and this, we then run our words together or we don't pronounce our words so carefully, and that makes it difficult for that person with the hearing loss to understand. And this is especially important over the phone because you're taking away those visual cues. So it's really important if you're talking to someone on the phone that you speak slowly and distinctly so they can kind of keep up with that conversation and be able to understand what you're saying. It's also important, another communication strategy is to reduce background noise if you can. So in the home, in your private life, this is pretty easy to do. So if you're watching television and try to have a conversation, hit the mute button on the TV. If you're in the kitchen and there's water running, you turn off that water, or if maybe the dishwasher's running, get out of the kitchen to have your conversation. In the car, if the radio's on, turn the radio down to talk. Out in public, that's not as easy to do. Obviously, you can't necessarily control the noise that's out in public, but as much as you can, even if you're at a restaurant trying to get a table in the corner or towards the edge, so you're not in the middle of the restaurant, you're not by the kitchen area where the door keeps opening and closing and kitchen sound, or away from the bar area where there might be a lot of people and the talking's a little bit louder. All right, so that concludes what I had prepared for today. Does anyone have any questions, comments?
You can go ahead and click on Q&A or chat at the bottom of your screen. Feel free to type those in. Thank you, Dr. Kansas. It's amazing the
Okay.
technology and how far hearing aids have come to be
Yes,
able to
it
plug in and
is.
charge them like an iPod.
Yeah,
Headphone is amazing.
we audiologists have had to become like Bluetooth experts in the past few years. I didn't realize I was going to be working with people's phones so much. So it's sometimes challenging, but it's great for them.
Do you have any suggestions for, I guess, what I'll call maybe like hearing hygiene? Like if you're using headphones like you have in, or Apple Pods or any of those devices, like how long you should allow them to be in, what volume those kinds of devices that they're hooked up to
Yes,
should be
that's
at when you're listening?
yeah. A good rule of thumb is like 50% or less. So if you wherever you can set your volume, if it's at half of that volume or less, then you should be good as far as your exposure to sounds. That should not, according at least for people who are in the workplace, it's 85 dB that where regulations come into play that level or above would be harmful to your hearing. And even at 85 dB, someone can be exposed to that for 8 hours without, every day for it not to affect your hearing. But if you're setting any headphones lower, like at 50% or less, it should be well below that, and you'll be in good shape.
Okay.
But if
Tell
you
that to
are
my
ever around,
teenager.
oh yes, yeah, right. And actually, some devices, like the Apple products, do have a way to go in and limit that. So you can set where the maximum volume is, and then if they turn it up, it doesn't get to where it would be too loud. Yes,
Good
good
to know.
question. Yeah, but it's important even if you're people don't really think about it, but if you're maintaining, like you have your lawnmower or leaf blower, things like that, it's really important to wear hearing protection when you're using those. You're not using them for very long, but over the course of time, you're using them once a week for how many years, it can have an effect on your hearing. So it's important to wear hearing protection for those.
What about with cleaning your ears? We talked about not using cotton swabs. So should you go to your physician regularly to have wax buildup looked at, or what do you
Yeah,
recommend for that?
so our ears are actually self-cleaning. Our ears do produce, so the ear canal, about the outer 2/3 of it, there are the glands that make the wax, and there's little hairs. And so your body makes the wax in the ear canal, and the hairs push the wax out of the ear. So the wax is actually there to help clean your ear. So when we're taking the wax out, we're actually removing the item that is supposed to be there to clean your ear. So those hairs will move the wax out of your ear. It's totally normal to have wax in your ears. It's perfectly fine, and it's healthy, and it's there for a reason. So really all you should do on a regular basis is just when you're washing your face or taking a shower, just take the washcloth and really just wipe around the outside of your ear. Nothing really should go into the ear canal. Some people do, though, make a lot of wax, and the hair doesn't move it out as effectively, in which case they might get a buildup of wax. So you can either go to your physician and have them remove that wax themselves. There are over-the-counter kits that you can use. Debrox and Urine are typically the ones that you'll find in the drugstore, and those are drops that you can use. You typically, like if you lay down, it's easier if someone helps you with it because they can kind of see what they're doing, but you lay down on your side with one ear up, they pull back on your ear, and they can put perhaps like 4 or 5 drops in. And then if you push right here, it'll kind of help the drops to get down. Lay like that for about 15 minutes. So they have their time to work down into the ear canal, and then you can do the other side. You might hear a bubbling sound. There is like a peroxide in it, so you might hear like a bubbling sound in your ear. The purpose of those drops is to soften the wax, which is good because it helps the wax get out better, but it may not remove the wax. It might just soften it. So sometimes they come with a bulb syringe also, so that you can use lukewarm water to help flush that out. But honestly, I would only recommend that if you're getting that buildup of wax. So, typically people do have an appointment scheduled with their physician, at least every year or so. So, ask them to take a look in your ears just to make sure. They'll let you know if there's that buildup there, or if you notice that you're not hearing as well, it could be caused by wax. But like I said, some people just make more wax than others, and it may not get out effectively. But I will say that using Q-tips can also build up the wax, because what happens is you take the Q-tip and you put it in your ear, and you might scoop some wax out, but you also push some of the wax down further into your ear, and you push it down past where those little hairs are that are working to move the wax out. And so over time, as you're doing that every single day, it's pushing wax down there. And a lot of times, like I can look in someone's ear and I know if they're using Q-tips or not because I can actually see like a wall of wax, and it's actually kind of concave a little bit, and you can tell like that's the tip of the Q-tip that has been used to push the wax down into their ears. So really, we should, like when your mother said like don't put anything smaller than your elbow in your ear, that was totally correct. Our ears are self-cleaning. Just use a washcloth right around. That's all you really need to do. If you're concerned you have wax, have an audiologist or physician take a look in your ear to see if there's a buildup. And then, like I said, over-the-counter drops if there's something that needs to be softened.
Thank you. Don't see any other questions that have come in at this point. There's a question about buildup, but I think you covered.
Okay, yeah, I saw that one pop up, so I was trying to.
You are back with us June 25th, it looks like, to talk about what is the best hearing aid for me, to discuss those varieties that you kind of touched on briefly that are out there. So
yes, great.
Look forward to that. We appreciate you being here with us today.
Thanks for having me. I appreciate it.
We'll see you in a couple of months. Thank you.
All right. Thank you. Bye.
Bye-bye.